the tragic case of David Reimer, the boy raised as a girl after a medical experiment. In 1965, in the city of Winnipeg, a baby boy named David Reimer was born into what seemed like a normal Canadian family. For the first few months of his life, nothing appeared unusual. But when David was just 8 months old, a routine medical procedure changed his life forever. During a circumcision performed with an experimental medical device, a tragic accident occurred that destroyed his penis. His devastated parents desperately searched for medical advice about what could be done for their son's future. Eventually, they were referred to a well-known psychologist named John Money at Johns Hopkins University in the United States. At the time, Money was famous for his theory that gender identity was largely shaped by environment and upbringing rather than biology. After examining David's situation, he recommended a radical and controversial solution. The child should undergo surgery to remove his remaining male anatomy and be raised as a girl. According to Money's theory, if the child grew up believing he was female, he would naturally develop a female identity. Following this advice, David's parents agreed to the procedure. David was renamed Brenda and began being raised as a girl, wearing dresses, growing long hair, and later undergoing estrogen treatments during childhood. For years, John Money publicly presented the case in academic papers and lectures as proof that gender identity could be shaped entirely by social upbringing. In the medical community, the Brenda case was often cited as successful evidence supporting his ideas, but behind the scenes, the reality was very different. From an early age, David felt deeply uncomfortable living as a girl. Despite being told he was female, he resisted dresses, preferred traditionally masculine toys, and struggled socially with other children. As he grew older, his distress only intensified. Teachers and doctors noticed that Brenda seemed unhappy and confused about her identity, yet the truth about the accident had never been revealed to her. By the time David reached his early teenage years, the psychological pressure had become overwhelming. Finally, at around age 14 or 15, his parents made the difficult decision to tell him the truth about what had happened in infancy. Learning about the medical accident and the years of secrecy was shocking, but it also gave David an explanation for the feelings he had experienced his entire life. Soon after discovering the truth, he made a firm decision to live again as a male. He chose the name David and began transitioning back, undergoing medical treatments and surgeries to restore a male identity as much as possible. As an adult, David tried to rebuild his life. He eventually married a woman and became a stepfather to her children, attempting to create a sense of normalcy after years of trauma. However, the psychological scars from his childhood remained incredibly deep. The combination of public attention, medical experimentation, and personal suffering contributed to long-term struggles with depression and emotional pain. Tragically, in 2004, at the age of 38, David Reimer died by suicide. His story shocked the world and forced many researchers and doctors to rethink assumptions about gender identity and medical ethics. What had once been presented as a successful scientific experiment became widely recognized as a cautionary tale about the dangers of experimental treatments performed without a child's consent. Today, David Reimer's life is frequently discussed in debates about medical ethics, gender identity research, and the treatment of intersex and pediatric patients. His story serves as a powerful reminder that scientific theories can have profound consequences on real human lives, and that the voices and well-being of patients, especially children, must always come before any attempt to prove a medical idea.